Hello, and welcome to Chapter 18 in FVA Essentials of Healthcare, talking about the digestive system. This lecture is going to be split into two parts, so this will be part one. So, when we're talking about the digestive system, first we really need to consider the organs or tools that aid in digestion. So, your teeth and your mouth, also known as your oral buccal cavity, is where it's really going to start. Your tongue is an accessory organ of digestion. You also have salivary glands. This is all going to help to start the process, but eventually the food is going to get down to the stomach, intestines. We have other organs such as the pancreas, liver, and gallbladder that are going to assist in the process of digestion. So we eat food, it goes through this entirely long track, and eventually we poop it out. That's called defecation. You can also call it excretion if you want. But after you eat, how long does it take for the stomach to empty? Roughly 2 to 6 hours. It's going to depend on what kind of foods you ate, how much liquid was in there as well. So when we start at the very beginning, our mouth, right? Teeth are great tools for us to munch and chomp on our food to try to break it up. If not, it'd be kind of hard to swallow an apple, sorry, maybe even an owl too. But we need to chew on our food. And you have 20 teeth by age 2, and you're going to have 32 by age 12. Now, most people don't know this, but your wisdom teeth are actually there when you're 13. They just haven't surfaced yet. They're just underneath the gums. And one of the reasons why we take those out is because they will push on the rest of the teeth, and we like our teeth to look pretty, and so we remove them so they don't shift the rest of the teeth. It was theorized that wisdom teeth were one way back in the day used to like chew on nuts or something, but now we really don't need them. Now, when we look at the actual part of the tooth, the top part is the enamel. It's the hardest substance in the human body, made of calcium phosphate. But if it's so hard, how do we actually chip it? I don't know if you've ever chipped a tooth. I've got plenty. But the way we chip it is, first of all, we continuously chomp and use them. So that tissue will break down eventually just by nonstop pressure. We also have things like erosion that occur just by having teeth and eating. There's substances and chemicals that get on there and they break it down. We also could be dumb sometimes and bite things that are harder than our teeth. I put keys in my mouth, and one time I chomped down on it just to hold it, and that's what chipped my tooth. Now, dentin is the middle or the inner shell, I guess you could call it. This is where most of the tooth, and it's like bone, but it has a lot more living cells in it. And then you have a pulp cavity, which is going to be right down in the middle in this area. And this is where you really have your blood vessels and nerves, okay? Now, you could have a lot of teeth issues if you don't take care of them. You'll see in this picture right here where the pulp is, and you have a nice little fresh pulp on the left-hand side. And then you have an infected pulp that gets all the way down to the bottom, and there could be an infection and a abscess. And so a root canal is where they have to go all the way down through there and kind of replace that entire root where it attaches to the bone in your jaw. Now, the most typical issue that we have with our teeth are going to be cavities. You probably know this. They can occur anywhere on the tooth. You can see here there's one on the top where the crown is. There's one on the side, one by the root as well. And of course, brushing and flossing are the best ways to prevent this. Now, I wrote ain't nobody got time for that, because this is the one thing that not a lot of people do. And I hate when I go to the dentist and they tell me that I should be using string, because it's not realistic to getting someone to want to floss their teeth. Now, a floss pick, the water guy right here, is supposed to be really good, but a lot of dentists actually don't approve of them. These little tooth picks right here with a little piece of string are the best for compromise in how to use it and being effective. And so if you're actually trying to floss your teeth and you actually scrape each side with this little toothpick, you can be doing a great job. Now, if you get a tooth replacement, this is what it's going to look like. And I really hate seeing people with grills. This is a character from James Bond back in the day where his name was Jaws. He had grills and they were great for chomping metal. But when you're paying to remove your teeth and replace them with veneers or diamonds or something, think about all this lost bone tissue. You're literally replacing your joint for aesthetic purposes before your body actually needs a joint replacement. And if you do that ahead of time, you might not have enough tissue to work with when all your diamonds and jewels start to erode. So try to keep those teeth as pearly white as possible for as long as possible. Now, once you get past the teeth, we have the mouth. Okay, here is a picture of where a lot of the glands are. You can see we have one underneath our tongue. We have one right behind our jaw muscle, below our ear. Then we have this big purple thing in the middle. What do you think that big purple thing is? It kind of looks weird, huh? Well, that's our tongue. Our tongue can help move food around. It has taste buds on there to actually taste food, which is about 15 to 20% of taste. But these glands help to produce, saliva, amylase that digest starch, lysozyme, which is antibacterial to fight bacteria in there. And then you also have mucin, which is like a lubricant, and this just helps chew up that food eventually to be able to swallow it. Now, the amount of saliva we have, we actually produce 2 to 4 pints of saliva each day. That is a lot, but we swallow a lot of it, right? You could actually fill a bathtub with the amount of saliva that you produce in a year. And you also feel like your mouth gets wet before you vomit too, because it's gonna counter the acid coming up from your stomach. Now, you probably have heard of plaque. This is a bacteria that gets into our teeth. It grows, and when you have it really bad, your breath is gonna smell like you're breathing fire. But this is really one of the biggest reasons why we brush our teeth. You don't want that plaque, that bacteria to build up in your teeth, and it can actually lead to heart disease and obviously other digestive issues. There is always a sticky matrix of the plaque, and that actually traps food as well. Okay, your esophagus. Now, this is your muscular tube that transports swallow food to the stomach. Okay, there is something called peristalsis, which is involuntary muscle contractions. And you'll see in the bottom right hand corner over here, this is where you see that ball of food actually getting moved down our esophagus, which is the tube from our nasal cavity, that area, right? The pharynx, they were talking about respiratory, and pushes it all the way down into the stomach. But to have that be able to happen, you have to be able to chew your food and mash it up into a bolus, which is that circular thing you see in the esophagus. Now, there is a little trap door right there. You probably will remember it from when we were talking about the respiratory. It's called an epiglottis. It stops food from going down the trachea, and that way the food knows to go down the esophagus. Because if that is open when you're drinking water, you're technically choking or drowning when you're choking, right? Water is going down into your lungs. And of course, we don't want food to get stuck in there. You also have a couple of layers. You have the mucosa, submucosa, muscular, and externus serous as well, but we'll talk about that in a little bit as well. So when you get to your stomach, you'll notice that it is curved. The top portion lets food drop down, but then you have a middle section where the food accumulates, and then you're going to try to get it to the pylorus end, which is right here, and this is where it's going to be passed on. Now, you have two sphincters, and what do sphincters do? Well, there's one right up here, which is called the esophageal sphincter, and then you have one down here, which is your pyloric sphincter. And what these two do is they basically they pinch their little circular muscle, and they only open when food is ready to pass. Okay? You have 4 layers similar to the esophagus of your stomach. The outside sheath is called the serosa. Underneath that, you have the muscularis, and this is where it can actually contract. We don't have that capability to do it consciously, but it is contracting to help stuff push. And then you have the submucosa, which is right between the muscle and the mucosa. And the mucosa is the interior wall of the stomach, and you can see it has a lot of little grooves in there as well. Now, you might have heard of what chyme or chyme is, And basically, it is when all of our muscles and fluid that's moving back and forward and food particles, they kind of are just like turning the stuff, the food that we ate up to make sure it's being ready to be digested, and it breaks down a little bit easier that way as well. Here you'll see a better portrayal of the four layers. And here's the mucosa, that most inner layer. And you notice that there's all these little gastric pits. And this is where food can come in. And you'll notice that there's cells that can actually break it down or absorb some of the stuff that's getting broken down. And then you'll see the different layers of the muscularis externa as well. And then the submucosa is just between the mucosa and the muscle. Now, within our stomach, we have a lot of gastric juices. This is really going to help break things down. And yes, some of the stuff in our stomach is acidic that can hurt other parts of our body. So, our glands in our stomach will produce secrete gastrin. This is what's going to help break down some things and melt things down. We also have parietal cells that produce hydrochloric acid. And if this stuff gets into your esophagus, it will burn. I put a picture of omeprazole right here because I was in middle school. I had acid reflux. I've been taking omeprazole for a long time, and it's really helped prevent the gastric juices from going up into my esophagus and producing that heartburn. You also have chief type cells that are going to produce pepsinogen, and this is an enzyme that breaks down protein, so a lot of meat. Whoops. And then you have mucus cells, and this just helps protect the stomach from being damaged, that alkaline mucus. So if you didn't have this, these acids would actually hurt your stomach, and sometimes you can have an ulcer or a little burn spot in your stomach too if you're not secreting this mucus. You also have renin. This is found in infants and children. This is mainly to help digest milk because, let's be honest, that is a large part of the diet of an infant or a child. Now, after your food goes through your stomach, it's going to start entering a very, very long track to get out of your body and still get nutrients absorbed. So the first part is going to be the small intestines, which is funny because the small intestines, even though in diameter they're smaller, they're actually longer than your large intestines. In fact, they're about 20 to 30 feet. That is the height of a telephone pole. So that's a lot. You have the duodenum, the jejunum, and the ileum, and these are really just different roads of the small intestines. And so they're the same, but they're just different paths of that one big road. And here's a good picture so you can kind of put together all of the organs that are occurring to transport food to get digested and then eventually evacuated. Now, we have a lot of absorption in the small intestine. A lot of water gets absorbed in this area, and there's these little villi, like looks like organic hair, and basically that just makes a lot of more surface area so that our small intestines can absorb all the nutrients possible. So not only water, but vitamins and minerals are getting absorbed, carbs are getting absorbed, and then eventually produced into energy. And I thought this was cool because you just learned about alveoli, right, and how they do gas exchange in the respiratory system. And if you had the same surface area of alveoli spread out, it would equal a tennis court. And so there's a lot of surface area in our bodies and a lot of little things, but they actually add up to be big things. So whatever is digested will get passed through the villi into the bloodstream. So you're going to have a lot of these juices involved, enzymes, secretin. I'm not even going to try to, I guess, cholecystokinin and bile and pancreatic juice that helps break this stuff down. But there is one thing that doesn't get digested, and that's this little poor pepper. Vegetables do not get digested, and they just get passed along, and they're basically just bulk for our feces. That's poop. Now, your large intestines, this has a much bigger, diameter. It's about 5 feet long. It's also called your colon because it's on the way leaving your body. The ileum empties chyme into the ileocecal valve into the large intestine right here. And then it also secretes a lot of mucus to lubricate the passageway for all the waste because now we really have absorbed everything we need from the food and now it's time for it to leave our body. The cecum and appendix are right here at the very beginning, and this really just catches the stuff that needs to get transported. The appendix, well, we don't really know what that does. We think it could have done something back in the day, but now it just sits there and sometimes gets inflamed, which I'll talk about in another lecture. But you'll notice that you have an ascending, transverse, and descending colon. So ascending, it's literally going up. The transverse, it's going across or horizontal, and then descending, it's starting to go down towards our anus to be evacuated from our body. And again, this all happens through peristalsis, where these intestinal muscle walls are actually contracting to continue to push viscera out and eventually head out the body. That's where we'll stop for this lecture.